Okay, Ajay, go. Aboriginal health is linked to the legislated state of colonization, racism, exploitation, and abuse that has been our experience as First Nations people. My vision of health starts with educating every Canadian about the deeply entrenched and legislated racism that has made us all so sick. My vision includes transformative change accord First Nations health plan. It's a good start to fixing what is wrong with the mainstream healthcare system so that we can access health. But it's just a start. We have a far bigger vision of health that I would like to share with you now. Our cultural practices are key to our health. There is finally evidence to prove this, and yet we have always known this to be true. Here you can see Jerry is renewing our spirits with his song, and my vision of health includes a place in the mainstream healthcare system for respected elders like Jerry. I envision healthy First Nations youth who will never ever experience the shame of being Canadian society's scapegoat. Our children and your children will be working together to knock down the last mean-spirited walls of the Indian Act and celebrating the end of the last known race-based legislation in the Western world. I envision a healthy community spirit like this slide coming up. At Gitsigukla Cannery Row, when the community gathered to put up a supply of canned Skeena River sockeye for the winter. This sockeye was provided to the elders and shut-ins in the community who would not have been able to put up their own supply of fish. I envision spiritual wellness that my ancestors enjoyed, the fine balance we need in our lives in these ever more complex times. Our spiritual customs were alien to the Christian colonizers, and our practices were outlawed. I envision a full-on renaissance of Indigenous spiritual practices. My vision also includes ancient ways of knowing and being, and our traditional healing ways, which are thriving in modern practices in all health sectors. For us, health is physical, mental, emotional, and spiritual wellness. It is so much more than the absence of disease. My vision of traditional medicine is practicing and sharing our knowledge of our healing ways without worry of being dismissed, disparaged, exploited, legislated, and relegated. We may see wildflowers or weeds. A healer may see tools for good health. I envision macaroni and cheese with mystery meat as a distant memory of the times when oppressive policy restricted our access to traditional food. I envision our Aboriginal youth being nurtured daily with our wholesome traditional foods like the smoked salmon you see here. I envision teaching our youth a history of Canada that is relevant and in a way that does not marginalize but includes. I envision youth learning our culture in the old style, intergenerational learning we call it now. The way this 95-year-old woman in the striped shirt is overseeing this canning workshop. I envision our worldview as supported and thriving and no longer under threat by policy, rules, and colonizing ideologies. I envision a time when we are no longer just collateral damage for the greater good, and when we no longer have to explain ourselves to justify our existence. I envision our youth will pass on sacred ways and knowledge, like our understanding of environmentalism. I envision all our youth as visionaries who take the best parts of their old and new worlds and integrate their sacred knowledge into a strengthened humanity, repairing the harm that we have done in this lifetime. I envision a world where Canadians embrace the wisdom of our elders, who can clearly see the things we younger people cannot possibly know. Their health and healing is vital to our survival and for the upcoming generations. I envision seeking the knowledge and advice of our matriarchs for major decisions. I envision a truly equitable system where we make extra effort to ensure that every First Nations and Aboriginal person is accessing health services, good food, decent housing, education, employment, and time to give back and be part of community. I envision a time where every Canadian gets and understands the notion of connection to all things, and that decisions to clear-cut or voraciously exploit the earth are old, outdated thinking from the days when we all suffered from a collective lack of awareness. I envision that we are all caretakers of the land and are thinking of 7 generations ahead and 7 generations behind us. I envision us sincerely applying an earth lens to all development resource proposals before we make decisions that may permanently destroy or contaminate our earth. My vision of health is about sharing the path with our 4-legged sisters and brothers, with the winged and the finned creatures. I envision a time when we humans are no longer expressing our overbearing sense of childish entitlement over the creatures and the land that gives us life and sustains us. I envision our understanding of whole health is one of accepting both our privilege and our responsibility. I envision each of us participating in the wealth of this land equitably. I envision us making extra effort to ensure healthy abundance for all people. This is our wellness model, and you've probably guessed by now that it's not a new model. In fact, it's an ancient old model that had worked fairly well for us in the past, better, in fact, than our current system. It can work again if we all commit to a vision of whole health and an inclusive and equitable model of wellness. Finally, I envision our health to include reverence for all things through ritual. Here is a grandfather and grandson in regalia. Do you see their sense of connection to the land, to the culture, to the world? Do you feel their deep sense of belonging? This is my wish and my vision of health for each and every one of you here tonight.